right. Okay. I need to ask you, Ojin.
What?
All right. I've been reading up on this healthcare plan that was just passed, and I want to know what's like one good thing about it. Like you know like one good thing about it, at least like just one.
Just one?
Just one. I want to hear one good thing about it.
Well, let's see. I feel that this healthcare plan is a step in the right direction. The way I see it, not all of us live very privileged lives like you and me. Like there are many of us who are living in very poor conditions. Like there are a number of people who can only get minimum paying jobs and can get only so much money that they're unable to be able to buy insurance plans. Is it really fair to conclude that because we don't need universal healthcare, nobody else does? There's such government programs like welfare, EOPS, food stamps, and many others to help these people who are having a very hard time going on through with life. And those are being paid by our taxes as well. What's one more thing to help others with this healthcare plan?
So I guess the main question I have for you, Ian, is if we already have EOPS and all these different things for the needy, why add on to make us pay for more for the needy?
I don't really think I have a very good definitive answer that can really answer that, but simply that all these programs are aimed to help these people like possibly get out of this rut they're in. And just by adding like healthcare, they'll have one less worry to pay about, and this could even lead them to getting a better life. It's mainly like just through our own empathy that we want to help these people.
I don't know, Hoj. The main thing I've been reading so far is that if we do have this bill go the way it's going right now, that we're gonna basically have the government run hospitals, which means that they can ration equipment, drugs, services. I mean, they can actually tell people what they can and can't have based on their political views, their philosophical views. I mean, it's all about power with this system. I don't know if I like it.
I can see where you're going with that, Bobby, and unfortunately I have to say I agree with those possibilities happening. I mean, this plan isn't perfect right now. I really hope that in the future that will allow for more privatized health insurance companies to pop up somewhere with this idea of universal health care. So people who want the choice to get those private healthcare can, but at the very least, those who are unable to get those sort of luxuries are still protected somewhat with a universal healthcare plan.
I don't know. I guess the main concern I have is if we do have healthcare being government owned, won't that like deter many youth from wanting to become a doctor in their future? I mean, if it is government owned, then the hospitals will have more rules and regulations to get against what doctors can and can't do, and also they'll also have to worry about their salary. Wouldn't it reduce their salary? I mean, isn't this a big thing that we should be worried about?
I could see that being a big issue, but it's an issue that I personally cannot foresee. I mean, there are many jobs out there that people risk their lives or do hard work and not be paid like for their efforts, like say policemen or firemen. These are people who are being paid by the government, but they're doing jobs that risk their lives. So personally, we just have to hope that our population still has enough people who are willing to do the hard work and effort in order to save people's lives.
I can see where you're going with that, Hochin, and I do agree. Police officers and firefighters are very noble people, and they fight for our lives every day. But another government job, by the way, an example of one is probably an airline pilot. They work for very low pay, and they have to go to college and get a degree to be able to actually fly planes. And the reason that they right now are having hard times because of their pay and the amount of loan money they get for college. It's hard for them to pay off the loan money, and they have to get two jobs. So a lot of pilots these days are having a very hard time and disgruntled because of their pay, and a lot of them are kind of tired on their job, and we've had a few accidents lately because of that. So I'd hate to think about that going over to a hospital where I would be under a knife of a doctor who can't pay his bills, can't pay for his loan because he can't get a second job because he's already tired enough, and also having to spend so much time at a hospital already paying for whatever he needs. It'd be very scary to think that I would be under the knife of a person that's that tired and that disgruntled. Where would that leave our doctors right now?
I'm no mind reader, and every person is different. Like, for all you know, even if you had like a top-notch doctor, maybe on that specific day he's not having a great day and he makes mistakes. You can't really truly prevent these types of things. I necessarily do not think that there will be more bad doctors because of this.
Well, I guess thank you for answering the question, but I don't know if I feel comfortable enough saying that this is the right move for America's healthcare system.
I can see how you can disagree with me, but here's another way you can think about it. There are many policemen and firemen who are on government pay who do incredibly exceptional work. I'm sure you've heard about a couple of them. They do way above their call and duty to do these amazing feats to help other people. So I'm sure the same will happen with doctors who are going to be on a government bill. So even if they're paid through the government, through our taxes, I'm sure we'll still be able to have very good doctors. Now that I think about it, now that the switch from corporation-run healthcare to government-run healthcare, isn't that a bit better? I mean, with corporations, their main goal is to make money.
Yeah, I can see why you'd say that. Well, the thing is, I believe that corporations probably would be able to control hospitals better than government because, I mean, corporations, they run like a business. I mean, they are structured and they know what they're doing. And I feel that if we've already been having corporations control hospitals already, why change a thing now? I mean, we're doing a good job. From what I've seen and heard, I feel that we're doing a good job, so I don't know why we would change it now.
You're not seeing it in the face of like many other people. I'm sure you've heard about people who unfortunately lost their insurance plan because of a thing called pre-existing conditions, a sort of clause that allows insurance companies to bail out on not bail out, to not pay for someone's like very expensive procedure by saying they had a condition before, not mentioned that they had a condition that nullifies their insurance, thus taking their insurance away and not paying for something that they truly need.
Well, even though I'm still not very comfortable with the entire situation of this healthcare bill, I just want to thank you for at least giving me your opinion about it.
Yeah, and even then, it's just an opinion. I'm not 100% sure how things will turn out, and hopefully it'll turn out for the better. So, my good man,